Have you ever gone to the doctor after having your company change health plans and the office tells you your insurance isn't showing up in the system yet? That situation happens more often than you might think, but the good news is it's usually very easy to avoid. When a company changes its group health insurance plan, it's usually for a good reason. Better coverage, lower cost, or a stronger provider network. But in the first few weeks after the plan change, it can sometimes create confusion for employees and their families if they don't know what to expect. Over the years, I found that most of those frustrations are completely avoidable with a little planning. Let me share a few tips. First, if you take prescription medications, refill them before the new plan begins if possible. Ideally, you want to have at least a 30-day supply on hand, but you might have a 90-day mail order prescription plan. Get as many as you can. That way, even if it took a whole month to get your new plan in the system, you don't have to worry about your maintenance medicines. Even though the new coverage technically starts on the effective date, it can sometimes take 2 to 3 weeks for pharmacy systems and provider databases to fully update. Having medications already filled prevents unnecessary stress during that transition period. Second, if you can help it, avoid scheduling non-emergency medical care during the first month of the plan. Your coverage is active from day one, but administrative systems still may be updating your eligibility, group numbers, and provider databases. Trying to use the insurance immediately can cause temporary confusion at the doctor's office, give you heartburn, and your agent heartburn like me. A little patience during that first month usually leads to a much smoother experience.
That's a great point, Papa D. Many people assume insurance systems update instantly, but in reality, several different systems have to synchronize. Employer records, insurance company databases, pharmacies, hospitals, and provider networks. So during the first few weeks, the coverage may be active, but the systems are still catching up.
Exactly. Now, there's another tip that might that many employers might overlook, and it's an important one. Employees and covered dependents should know their company's group health plan anniversary date. That's the month when employers typically review their health insurance plan and decide whether to renew the current plan or switch to a different one. Because of that, the most likely time for a plan change is either on the anniversary month, the following month, or sometimes on January 1 if the plan operates on a calendar year. And even sometimes companies may want to switch to a calendar year. So avoid having your wellness visit in January or any doctor's visit unless it's an emergency or you're truly sick or have an accident. Since wellness visits can be scheduled anytime during the year, just simply avoid those months. It's just that simple.
From an employer perspective, that's very important. When employees understand when their company's plan renews, they can plan their healthcare visits more strategically and avoid unnecessary confusion during a transition. A little communication from employers goes a long way.
Now, sometimes medical care can't wait. If you or a family member see a doctor or go to the hospital during a transition, here's what I always tell my clients to say to the provider. Say something like, our employer recently switched group health plans. Our coverage became effective on the first of the month, but we haven't received our group number yet, and we may not be fully in the system. Could you wait a few days, maybe even a week before submitting the claim? I'll call you back with the new information, and if necessary, you can contact my insurance agent to confirm the benefits. That simple conversation can prevent a lot of unnecessary confusion. If you have a prescription drug that has to be filled, like an antibiotic, something that's not a maintenance drug, just pay for it and hang on to your receipt and file for a reimbursement. That's simple. And always, if questions come up during a plan change, it's best to reach out early than to wait until there's a problem.